Nurses unions in the country have insisted that they are not about to let up on the ongoing medical workers' strike that today entered its 6th day. The union officials, led by its Secretary General Seth Panyako, have issued fresh demands in the ongoing talks, insisting that what the CBA agreed upon should now be backdated to January 2014, when health services were devolved. The union has now threatened to spearhead a complete paralysis of medical services come Tuesday at the Kenyatta National Hospital, including intensive care units where nurses have been treating patients in critical condition. Here is Timothy Otieno beginning our coverage tonight with that report.
A synonymous tune for a group rejuvenating its efforts in pushing for fair pay for their workers who insist negotiations are on the right path. For the past 2 days, the nurses' unions and government have engaged in intense deliberations with the aim of unlocking an unhealthy deadlock that has seen medical services across public hospitals stall. Today, the unions are issuing fresh demands amidst ongoing negotiations with government.
If the government will give any offer to any public servant that is going to be higher than what it has given to nurses in terms of basic salary, that offer that will be given to any public servants will and must apply on nurses.
But as the nurses' union officials remained adamant over the ongoing strike, a government-led delegation of health workers' unions representing, among others, nutritionists, orthopedics, clinical officers and social workers under the banner of the Kenya Health Professional Society were dancing to a different tune.
We share the grievances of the doctors and the nurses, but we stand here to say that the lives of Kenyans are more important, and that it comes a time when we really must rethink what we want as professionals. Indeed, as professionals, we took the Hippocratic oath that above all, life would be more important to us.
I want to stand here, and nurses know me, to support the decision by the Kenya Health Professional Society that the society return to work immediately. Let nurses in all counties go back to their respective working stations.
The crisis attracting a rare move that saw the Kenya Defence Forces medical officers leave their camps and enter the emergency wards to step in as soldiers of hope in a stalemate that has already seen more than 20 people lose their lives. The nurses say that the only way to make headway in the talks is if county governments sign a recognition agreement meant to appreciate the role of nurses countrywide and the fact that most medical services have been devolved.
If the governors could have signed, for example, the recognition agreement, you know what will be happening in the country today? All ICUs in Kenya will be working. All maternity labor wards for the patients who have been admitted will be functioning. All newborn units will not be closed down for the children who can't breathe on their own. But because the county governments have refused to sign recognition agreement, it is free for all. We call strike the way we want, we call off the way we want.
I don't understand the people who are pumping their chests and declaring ultimatums when people are dying, especially at a time that the government has unequivocally said we want to negotiate with everybody.
The Kenya National Union of Nurses has called a meeting of its governing council on Monday to chart a way forward over the matter, even as they insist that no worker will resume duties unless a harmonized collective bargaining has been agreed upon. Timothy Otieno, KTN News.